Have you ever stopped to wonder just how often should seniors really bathe? Is daily showering truly beneficial, or could it be doing more harm than good? Welcome everyone to today's deep dive into a topic that affects us all, whether you're a senior yourself or care for someone who is. Today, we unravel the surprising truths about bathing frequency and senior health, revealing some insights that might just change the way you think about your daily routine. Bathing is such a deeply ingrained part of our lives. It's almost as automatic as brushing our teeth in the morning. But what if I told you that for seniors, less might be more when it comes to washing up? In this video, we'll explore how adapting bathing habits can significantly impact the health and well-being of our elderly loved ones. And yes, it might even extend their life. So, if you've ever questioned the norm, stay tuned, because what we're about to uncover could turn the tide on the traditional rules of hygiene. And while you're here, why not click that subscribe button? Join us as we dive into the science, hear from experts, and learn about practical, health-boosting alternatives to daily showers. Let's get started. And don't forget to share your thoughts in the comments as we go. What's your current bathing routine? The common misconceptions about bathing for seniors. Moving on from our introduction, let's delve into why many of us grew up with the belief that daily bathing is a must. This notion isn't just a personal preference, but a cultural standard that spans across continents. From the bustling streets of New York to the serene countryside of Japan, daily showers have become synonymous with good hygiene. But is this standard applicable to everyone, especially our seniors? Research and experts suggest otherwise. The reality is that the senior skin is different. It's more delicate and less oily than younger skin, making the daily bath less of a necessity and more of a potential hazard. The question then arises, why do we cling so tightly to this routine that might not be suitable for older adults? It's largely due to habits passed down through generations, coupled with a strong societal emphasis on cleanliness that equates frequent bathing with rigorous personal care. As we age, our skin undergoes significant changes. It becomes thinner, less elastic, and the glands producing oil, which keeps the skin moisturized, become less active. When this natural oil is washed away too frequently, it can leave the skin vulnerable to dryness, irritation, and even infections. This is a critical point to consider for anyone responsible for senior care. Are we doing what's best for our loved ones, or are we following a routine simply because it's the norm? Let's pause here for a moment. Think about the seniors in your life. How often do they bathe, and have you noticed any skin dryness or irritation? Perhaps it's time to question the daily bath and look at the evidence pointing us towards a new approach. This isn't about compromising on hygiene, but adapting it to suit the changing needs of our bodies as we age. Engaging in this conversation isn't just about making a small adjustment to a daily routine. It's about enhancing quality of life and prioritizing health over habit. As we continue, keep in mind that each person is unique, and so are their healthcare needs. It's about finding a balance that maintains cleanliness without compromising the skin's integrity or the individual's comfort. What do you think so far? Do these ideas resonate with your experience? Share your thoughts below, and let's keep the discussion going. Now let's explore the specific health risks associated with frequent bathing for seniors. Understanding these risks will further clarify why rethinking the traditional bathing frequency is not just a suggestion, but a necessity for maintaining senior health. Health risks associated with frequent bathing for seniors. Now that we've discussed the societal norms and misconceptions around senior bathing practices, let's dive deeper into the actual risks associated with frequent bathing for seniors. It's crucial to understand the physical implications to make informed decisions about our loved ones' health and hygiene routines. Firstly, as we've mentioned, the natural oil production in older skin is reduced. This oil is vital as it acts as a barrier protecting against bacteria and keeping the skin moisturized. When seniors bathe too frequently, especially using hot water and harsh soaps, this protective layer is stripped away. The immediate result can be dry, itchy skin, but the long-term consequences are far more severe, including increased vulnerability to infections, eczema, and other skin disorders. Moreover, frequent bathing can exacerbate certain chronic conditions that are prevalent in older adults. For instance, individuals with diabetes or peripheral vascular disease are at higher risk for skin breakdown and ulcers. Bathing too often can increase these risks by drying out the skin and making it more prone to cracks and tears. This isn't just uncomfortable, it's a serious health hazard that can lead to infections requiring medical treatment. Another critical aspect to consider is the bathroom environment itself, which poses significant risks to seniors. The Centers for Disease Control and Prevention (CDC) report that about 235,000 people visit emergency rooms each year due to injuries suffered in the bathroom, with a substantial number of these incidents involving seniors. Slippery floors, hard surfaces, and the act of getting in and out of a tub or shower can lead to falls, which are a leading cause of injury and even death among older adults. Now, imagine reducing the number of times a senior needs to navigate this risky environment from daily to maybe just twice a week. The decrease in exposure to these hazards could statistically lower the risk of falls and related injuries. It's not just about skin health, it's about overall safety. As you absorb this information, think about the bathing routine of the seniors in your life. Could their insistence on maintaining a daily bathing routine be putting them at a greater risk? This segment isn't just a discussion, it's a call to action. Consider how changing this one aspect of their routine could safeguard their health and significantly enhance their quality of life. Are you beginning to see how less could be more when it comes to bathing in later life? Let's keep this conversation going in the comments. Your insights and experiences are invaluable as we explore this topic further. In the next part of our video, we will look at what experts recommend as the ideal bathing frequency for seniors and why these guidelines might be the key to better health and wellness. Alternative bathing frequencies recommended by experts. Having explored the risks associated with frequent bathing for seniors, let's now turn our attention to what health experts actually recommend when it comes to the ideal bathing frequency for older adults. This advice not only aims to maintain hygiene, but also to ensure overall health and safety. Experts in geriatric care suggest that seniors should ideally bathe once or twice a week. This recommendation is based on balancing the need for cleanliness with the need to preserve the natural oils on the skin and minimize health risks. Dr. Elaine C. Joan, a geriatric specialist, notes, "For older adults, less frequent bathing is often sufficient to meet sanitary needs without compromising the skin's integrity." The rationale behind this advice is multifaceted. Firstly, it considers the reduced activity levels of many seniors, which naturally results in less sweating and fewer oils and dirt accumulating on the skin. Secondly, as we've discussed, the reduced production of natural oils in aging skin means that frequent washing can lead to dryness and irritation more quickly than it would in younger individuals. However, it's important to highlight that these recommendations are not one-size-fits-all. Factors such as the senior's level of physical activity, overall health, and specific medical conditions, like incontinence, might necessitate adjustments. For instance, seniors who engage in physical activities, or those who may sweat more, might need to bathe more frequently than those who are less active. Similarly, those dealing with incontinence may require more frequent cleansing to prevent irritation and infections. Healthcare professionals also emphasize the importance of customized hygiene routines. For example, rather than a full bath, sponge baths focusing on high sweat areas like the armpits, groin, and face can be effective in maintaining cleanliness without the risks associated with full body bathing. This approach reduces water exposure and slip hazards while still addressing hygiene. As you consider these expert guidelines, think about how they can be adapted to fit the personal circumstances of the seniors in your life. Could a reduced bathing frequency coupled with targeted cleaning be the right approach? How might this shift in routine not only safeguard their skin, but also significantly decrease the risk of bathroom accidents? I encourage you to discuss this with health professionals and even bring this topic up with your family or friends. It's a conversation worth having as it touches directly on improving the quality of life for our seniors. In our next segment, we will discuss practical alternatives and methods to maintain hygiene without daily baths, providing real solutions that can be implemented right away. Stay tuned, and don't forget to like and subscribe if you're finding this information helpful. Effective hygiene practices without daily bathing. Transitioning from the recommended bathing frequencies, let's explore practical and effective hygiene practices that ensure cleanliness without the need for daily baths. These methods are especially beneficial for seniors, helping to maintain their health and dignity while minimizing risks. One of the most effective alternatives to daily bathing is the use of sponge baths, particularly focusing on key areas such as the face, underarms, and groin. These areas tend to accumulate more sweat and bacteria, and keeping them clean can significantly reduce the risk of infections and discomfort. Sponge baths can be done with minimal water and soap, ensuring that the skin does not become overly dry or irritated. This method is also safer for seniors as it reduces the risk of slips and falls in the bathroom by minimizing movement in wet areas. Wet wipes are another excellent tool for seniors to maintain hygiene. Opt for hypoallergenic and fragrance-free wipes to avoid any skin irritation. These can be used effectively to cleanse the skin when a full bath or shower is not necessary or practical. Wet wipes are gentle yet effective, and their convenience makes them perfect for quick cleanups throughout the day. It's also important to focus on hand hygiene, which is paramount in preventing the spread of infections. Seniors should be encouraged to wash their hands frequently with soap and warm water, especially after using the bathroom, before eating, and after coming into contact with potentially contaminated surfaces. For situations where hand washing isn't possible, using an alcohol-based hand sanitizer can provide an effective alternative. Oral hygiene is another critical aspect that should not be neglected. Brushing teeth twice a day and using dental floss can prevent gum disease and reduce the risk of heart disease, which is particularly important for seniors. If handling a traditional toothbrush is difficult, electric toothbrushes or even disposable tooth wipes can be excellent alternatives. Clothing and bedding hygiene also play significant roles in maintaining overall cleanliness. Regularly changing clothes, underwear, and bed linens can help keep odors at bay and reduce the risk of skin infections. It's crucial for seniors to wear clean clothes each day and to have their bedding changed at least once a week. Let's pause for a moment and reflect. Could these alternative hygiene practices be integrated into the routine of the senior in your life? By implementing these simple yet effective methods, we can ensure that our loved ones remain clean and healthy, even without daily showers. In our next segment, we will delve into how these hygiene practices are integrated into an overall health and wellness routine for seniors. Remember to engage in the comments with your thoughts or any questions you might have about these alternatives. Maintaining overall hygiene and health. As we continue our discussion on senior hygiene without daily bathing, it's important to look at the broader perspective of maintaining overall health and hygiene. These practices go beyond simple cleanliness, supporting a senior's health in a holistic way, reducing risks, and enhancing their quality of life. First, let's talk about environmental cleanliness, which plays a crucial role in a senior's health. Regular cleaning of living spaces is essential to minimize dust, allergens, and bacteria that can be harmful. Seniors, particularly those with respiratory issues or weakened immune systems, benefit greatly from a clean living environment. Vacuuming, dusting, and keeping surfaces sanitized can prevent a variety of health problems. Next, let's consider the air quality in the home. Using air purifiers can help reduce the presence of airborne particles and allergens that can exacerbate respiratory conditions. It's also beneficial to keep the humidity at a moderate level to prevent the growth of mold and mildew, which are common irritants that can affect a senior's health. Proper nutrition and hydration are also key components of maintaining health. Seniors should be encouraged to drink plenty of fluids throughout the day to stay hydrated, as dehydration can affect many aspects of health, including skin integrity. A balanced diet rich in vitamins, minerals, and other nutrients supports the body's ability to fight infections, maintain strong bones, and ensure overall vitality. Physical activity is another important aspect. Regular exercise, tailored to the individual's ability and health status, can improve circulation, increase muscle strength, maintain joint flexibility, and boost mental health. Activities such as walking, light stretching, or chair exercises can be highly beneficial and should be incorporated into daily routines whenever possible. Social interaction and mental stimulation are just as crucial as physical health. Engaging in social activities, whether in person or via digital means, helps combat loneliness and depression, which are common among seniors. Puzzles, reading, and hobbies that stimulate the mind are also important for maintaining cognitive function and emotional well-being. Lastly, regular medical checkups and adherence to medical advice are vital. Seniors should have routine visits with healthcare providers to monitor their health conditions and adjust treatments as necessary. These visits are also an opportunity to discuss hygiene practices and any potential adjustments needed based on their health status. In conclusion, maintaining hygiene and health in seniors involves a comprehensive approach that includes personal hygiene, environmental cleanliness, proper nutrition, physical and mental activity, and regular health care. Each element is interconnected, contributing to a healthier, more fulfilling lifestyle for seniors. In our final segment, we will summarize the key points discussed and wrap up our comprehensive guide on senior hygiene practices. Stay tuned, and don't forget to comment with any insights or questions you might have about maintaining overall hygiene and health for seniors. As we wrap up our discussion today, let's recap the key insights we've uncovered about the optimal bathing frequency for seniors and the various effective hygiene practices that can be employed instead of daily showers. We've learned that for many seniors, bathing just once or twice a week, supplemented by targeted cleaning and other hygiene methods like using wet wipes and maintaining oral and hand hygiene, can be sufficient and safer. These strategies not only protect their skin but also their overall health by reducing the risks associated with frequent bathing and slippery environments. Remember, adapting hygiene practices as we age is not about compromising on cleanliness, but rather about enhancing safety and quality of life. Thank you for joining me in this important conversation. If you found this video helpful, please like, subscribe, and share it with others who might benefit. Your engagement helps us reach and educate more people. Let's continue to care for our seniors with the respect and attention they deserve. Until next time, keep the conversation going in the comments, and always consult with a healthcare professional to tailor these recommendations to your personal health needs.